Hello everyone, I'm Dr. Bhoobalan. I'm a consultant nephrologist. Welcome to the first video of my dialysis series where we'll start from the basics and gradually move to more advanced topics. So what exactly is dialysis and who needs it? Dialysis is a procedure that removes waste products and excess water from the body when the kidneys are no longer able to do so. This can happen either in severe acute injury or in chronic kidney disease that has reached end-stage renal failure. When the kidneys fail, patients are unable to clear their metabolic waste and extra fluid through urine. That's when a nephrologist steps in to temporarily take over this vital function via dialysis. But does every patient with kidney failure require dialysis? Not at all. In acute kidney injury, dialysis is started when a patient develops problems such as severe fluid overload causing pulmonary edema, not responding to medicines, high potassium levels unresponsive to medical therapy, dangerous metabolic acidosis, or other serious symptoms attributable to uremia. In chronic kidney disease, we don't decide on dialysis based on creatinine levels alone. Instead, we assess how well the patient's blood pressure and electrolytes are controlled, whether there's acidosis or fluid overload, and most importantly, how the patient feels and functions in daily life. If a patient is stable with medicines, we continue medical therapy until symptoms of kidney failure appear. Now let's come back to the question, what actually happens in dialysis? In the simplest terms, dialysis is like cleaning the blood of impurities and removing extra water. There are two major ways to do this. One is hemodialysis and the other is peritoneal dialysis. In this series, we'll first focus on hemodialysis. In hemodialysis, blood is taken out of the patient and passed into a chamber called a dialyzer. Inside the dialyzer, the purification process occurs and the cleaned blood is then returned to the patient. So, what's inside the dialyzer? Think of it as a cylindrical chamber packed with thousands of hollow fibers. Blood flows inside these tiny fibers while a special fluid called dialysate flows on the outside. The walls of the hollow fibers have microscopic pores. Small waste molecules like urea, creatinine, etc. can pass freely through these pores and get into the dialysate compartment, whereas larger particles like red blood cells, white blood cells, and albumin are too big to cross and are safely returned to the patient. To simplify this, imagine a tea filter. When you pour tea through it, the liquid, that is, the water, milk, and the sugar pass through, while the tea leaves, being larger, stay back in the filter. The dialyzer works on a very similar principle, but here's the key point. If dialysis were just filtration, then even essential small molecules like sodium, calcium, glucose, etc. would keep getting lost, and the patient would be left with overly concentrated blood, and that wouldn't be safe. This is where the dialysate fluid comes into play. It's carefully designed with specific electrolytes. By controlling what's in the dialysate, we ensure that only the waste products and excess water are removed, while the useful substances are preserved. And that's what makes dialysis a life-saving therapy, not just a crude filtration process. Imagine you made a cup of tea, but it turned out too sweet. Now you want to reduce the sweetness, and you have two options. One, you could just add water or milk. This reduces the sweetness, but it also dilutes the tea essence, and that's not ideal. A better approach is to prepare another cup of tea without sugar and mix it with your sweet tea. And now you get tea with the perfect sugar balance. Sweetness is corrected and also the essence remains intact. This is exactly what happens via dialysate fluid in dialysis. If we just filter the fluid and small molecules from the blood, we end up with hemoconcentrated blood that is thick, high in hematocrit, and unsafe for the patient. So instead, we need a fluid that mimics plasma but without the waste products. Here to note, plasma is the fluid component of the blood containing the electrolytes like sodium, potassium, calcium, glucose, and also the waste molecules like urea, creatinine, etc. And dialysate is a solution carefully prepared to have normal physiological concentrations of essential molecules like sodium, glucose, calcium, etc., but without the toxins. So when blood high in urea and creatinine is placed in contact with the dialysate, the waste molecules move from blood to dialysate because they are in a higher concentration in blood. The essential molecules in blood like sodium, calcium, glucose do not move because the dialysate fluid already has them at physiological levels. But here, instead of mixing the dialysate fluid with patient's blood directly, which would cause volume overload, dialysis establishes the contact of these two fluids across a semi-permeable membrane. So, when the contact is made, the small molecules like urea, creatinine, and excess potassium move from the blood compartment to the dialysate compartment across the semi-permeable membrane, whereas the cellular elements like RBCs, WBCs, and protein remain in the blood, and these are then returned to the patient. So think of it this way. On one side, you have your sweet tea with tea leaves, which are analogous to blood with waste products and cellular elements. On the other side, you have your fresh tea without sugar, that is the dialysate fluid, and a filter is placed in between them, separating both the compartments, and that is your semi-permeable membrane of a hollow fiber dialyzer. Only the excess sugar, that is the waste products, move from the sweet tea to the fresh tea. The tea leaves and the milk, that's like blood cells and proteins, stay in the original cup. After this, the dialysate, now loaded with 50% of the blood toxins, is discarded and the blood is returned cleaned, balanced, and safe. So, by adding the dialysate fluid on the other side of the hollow fibers, we convert a mere filtration into specific toxin removal. So, the blood retains all the essential components while only the waste products are removed efficiently. And that's the magic of dialysate, turning blood filtration into safe, effective dialysis. Thank you for watching and see you in the next video.